Good evening, respected faculty and my fellow researchers. I am Dr. Vikram Khanna, and I'll be explaining how to formulate good research questions and research outcomes. A research question is a statement that identifies the phenomenon to be studied. For example, does TAD affect the outcome of DHS? A valid and clear research question is well justified, original, feasible, focused, and falls within the area of interest. If we have a research question in mind, we should go for a literature review to check whether that research question is viable, original, and feasible. If yes, then we have a research question. If no, then back to the drawing board. If I don't have a research question, then I'd first narrow down a research topic and then followed by a research review of literature to check whether the research topic is viable, original, and feasible. So if we don't have a research question in mind, then where to start? So first, narrow down an area of interest. Within that area of interest, try to answer a research question that has either not been addressed before or has been addressed, but you can extend it in a significant way that via a new data set or different theoretical approach, or pioneer a new research area of orthopedics, which is generally not recommended. In literature review, recent publications and studies will contain more updated literature. So try to collect these first, then read backwards to the most dated studies. Make sure you read all relevant papers. Ideas on research topic often come from this exercise. That is, if author X has not included factor Y in a study, so factor Y can be included. Literature review, when there is a potent question in mind, reviewing the literature will give an understanding whether the research question has already been answered or is a potentially valid one. Also, by reading previous studies, ideas how to tweak the original research question into a brand new one may be gotten. Again, start by reading the recent researches first. Bottom line, whether or not there is a research question, it is crucial to review the literature in that area first. Leaving literature review as the last step is very dangerous, as you may find that the question has already been answered or discarded by the literature because it is not relevant, not important, or not feasible. These are the various places where you can search for relevant literature. Common mistakes when identifying new literature questions are non-originality, non-feasibility. That is, there may be a time constraint. We may not have enough time to do the study. Resources, there may be lack of resources, lack of the knowledge how to do the study. Too broadly defined research question, or the research question may not be well justified. So we start with a broad topic, outcome of IT fractures. Okay, then we narrow it down. Outcome of IT fractures using DHS. Then we make it more focused, like correlation of maybe tip apex distance for managing of IT fractures with DHS. And then the research question can be formulated as, is there any correlation between the tip apex distance and the outcome of IT fractures using DHS? So tips, start searching for a topic as soon as you are allotted a research. After narrowing down a topic area, look for relevant literature. The research question should pass the literature review test. Has it been done already? No, then why not? Is it relevant or interesting? Ask the following questions when deciding the research question. Is the question specific? Is it feasible in the allotted time? Evaluate the resources available. How about knowledge to perform the study? Is the research question falling within the economic limitations of the study? If the answer is yes to all the previous questions, then we have our research question. Coming to outcome measures, an outcome measure is the result of a treatment or intervention that is used to objectively determine the baseline function of a patient at the beginning of the clinical trial. Once the treatment or intervention has commenced, the same instrument can be used to determine progress and efficacy. Outcome measures should be measurable which indicates that they are assessed by a numerical value. Primary outcome measure is determined as the outcome measure of the greatest importance specified in the protocol, usually the one used in the power calculation. Most clinical studies have one primary outcome measure, but a clinical study may have more than one. In layman terms, the primary outcome measures are the main reason why you are conducting the study. Secondary outcome measures is defined as outcome measure that is of lesser importance than a primary outcome measure, but is a part of a pre-specified analysis plan for evaluating the effects of the intervention or interventions under investigation in a clinical study, and is not specified as an exploratory or other measure. A clinical study may have more than one secondary outcome measure. Other pre-specified outcome measures are defined as any other measurements excluding post hoc measures that will be used to evaluate the interventions or for observational studies that are a focus of the study. Exploratory endpoints fall into this category. Post hoc outcome measures refers to outcomes that are specified after the trial has started. Considerations while selecting study outcomes. So the listing a large number of outcome measures may increase the chances of encountering issues. Consider outcomes that are clinically relevant, achievable, and address realistic research questions. Secondary versus exploratory. Appropriate secondary endpoints are often used to provide evidence that a particular mechanism underlies a demonstrated clinical effect. Exploratory outcomes are the ones being used to frame future research or explore new hypotheses. Outcome measure description. What information is being collected and how is it being collected needs to be pre-specified in all primary and secondary outcomes. If a scale, grading method, or a device is being used, then it has to be evaluated and specified initially only. Outcome measure time frame. The specific time points and of overall duration of the evaluation must be specified. If the outcome overall time duration can only be represented qualitatively, a specific numerical measure should then be included at the time of results reporting. This could be something like the median duration of follow-up or the range of the follow-up times. And lastly, outcome measures cannot be reported as free text graphs or qualitative information. It is allowed for the outcome measures to involve qualitative information, but it must also be able to be reported in a quantitative or numeric fashion. Thank you.